Thank you to everyone attending this conference. I regret that we must meet virtually, but we have all become Zoom experts over these challenging years. I was so honored to be asked to speak to you today. When I mentioned to my husband that the American Geriatric Psychiatry Association asked me to be a speaker, his question was, "Aren't you afraid you might get diagnosed?" He's so wonderful. Anyway, I had hoped to be with you in person, but my recent knee surgery has me restricted in walking for a few days. Before I begin, I would like to briefly tell you about Ncba, the National Caucus and Center on Black Aging, where I have been honored to be the CEO for 19 years. I know many, if not all of you, have never heard of us, and I always say that means that you've never needed us. Ncba is the oldest minority aging organization in the country, with over 52 years of providing programs in training and employment for low-income older workers. We own and manage senior affordable housing, provide health and wellness seminars and workshops, and advocate on aging issues and legislation. We have a proud history of advocating on issues that directly impact the quality of life, not just for African American older adults, but for all older people who deserve to live their lives with dignity and respect. Our mission has focused on older Americans, especially those who have not had the advantage of access to a quality education and employment opportunities, safe and affordable housing, access to quality health care, all obstructed or denied because of discrimination, racism, poverty, even zip code. I know it's hard to admit this country has not been fair to all its citizens. And even though we may all love this country, there are many Americans that this country has not loved back. At Ncba, we work hard to bring awareness, education, and opportunities to an older population that has faced many of these barriers and challenges. So that is the experience and the knowledge I bring to you today. I am by no means an expert on mental health. You have an impressive list of experts at this conference who have and will present the most up-to-date research on this health issue. Ncba partners with other organizations who provide mental health services, and we have assisted persons in finding needed care. Most often, we are called in emergency situations when there is a psychotic incident or questions on how to intervene in seeking mental health care for a loved one. What we have experienced is the difficulty in finding mental health programs that can assist older persons and their families, and it is a growing problem. What I hope to share with you today is how important your work, your care, is to your older patients who face these barriers to mental health counseling, and how we recognize and do better in meeting the needs of an older population that is aging in the dark. I need not tell you how difficult the last 2 years have been on all of us, but in particular, older adults. In the beginning, before there was a vaccine available, we were subjected to daily breaking news about this virus being very contagious, spreading all over the country, something many Americans had never experienced. Hearing about the rising hospitalizations and death tolls having the world we know change by shutting down, people required to stay home, or worse, people losing their jobs. We are told that we have to wear masks, wash our hands, disinfect our shared areas, and what? Social distance? The news was inundated with experts, scientists, doctors, health and public officials, all trying to explain what was happening. And let us not forget the doubters, the conspiracy theorists, the misinformation that required us to try somehow to distinguish between what was true and what was not. It is safe to say everybody was fearful. Meanwhile, what we did know was that people were dying, and people we knew were getting sick and unfortunately adding to that death number we'd see on our TV screens. Now, as medical professionals, you are equipped to manage these life occurrences better than the average person. That does not mean you weren't anxious too, but your medical training gives you somewhat of an advantage of understanding that others do not. For older adults, this pandemic hit the hardest. Yes, everyone was affected, but for older people, it has been extremely difficult. Early on, it was seeing all the nursing home deaths, having to isolate and not be with family and friends. Anxiety if you had a pre-existing condition, to include age. Then, when testing and vaccine sites were set up, navigating an appointment by internet, many of whom had no access or knowledge how to do so. And we initially had to bring attention to where these sites were set up, many not being accessible to older persons or in communities of color. Older adults' fear was understandable, and even with all the information that was shared about COVID-19, there were still so many unknowns. Now, for the people my organization represents, their fears were compounded with knowing that African Americans were disproportionately affected by this virus, and we know the reasons, so I need not go over all the social determinants that create a population plagued with health disparities. But now we are seeing how this pandemic compounded the multiple stresses of aging. Loneliness, lack of access to resources and support, chronic diseases, not being able to be with loved ones, and if a loved one was hospitalized, not being able to be with them, or worse, not being able to say goodbye. To add to that guilt, funerals in the Black community have historical significance and are a major tribute to our loved ones. Not being able to celebrate their lives as we traditionally have, I think has probably been the worst. Historically, for us, the death of a loved one was the promise of a better life in the beyond. When we comfort someone, we may say to him or her, they're in a better place. A condolence that comes from the hardship of slavery and later the mistreatment based only on our color, which is why many funerals, even today, are festive, because we are happy that that person does not have to deal with the inhumanity and the injustice imposed historically on our community. As you may know, the church continues to be a place of refuge for people. It has a strong history in not only developing our spirituality, but has always been a safe place to gather in peace and without fear. Ministers have a significant role in our lives. They baptize our children, they marry us, they bury us. They lead their congregations in issues such as civil rights, community volunteering, considered part of their ministry, and for their parishioners, a responsibility to their people. They help people to cope with the dreadful things of why do bad things happen to good people, disasters, injustice, using their religious teachings to explain these things as best they can. For many Black people, in times of crisis and confusion in their personal lives, they turn to the church and minister for guidance. And in tradition, we pray for the resolve to their concerns. It's a tremendous responsibility, if not a burden, for an untrained religious leader in mental health counseling. Now, add the last 2 years of stress, anxiety, and mental anguish onto the usual stress, anxiety, and mental anguish that people of color must absorb that other Americans do not. If for this moment, imagine a life where you grew up in two worlds, one for Black people and one for white people. Most of our older adults are children of separate facilities, discriminatory and unjust laws and rules. They remember. That must influence your mental psyche of living in a world that you are reminded you are different and therefore not capable or can meet your potential. Our older adults tell us stories of their childhoods, living on sharecropper farms, growing up in crowded slum housing, going to segregated schools, being told what your boundaries are rather than being allowed to self-determination. Their memories may seem so far in the past, but Brown versus Board of Education was only 68 years ago. Many of our seniors that are older well remember. If you're one to say, that's in the past, things have changed, you only need to look at the conditions and the difference between how older Black people age and those of other races. If you think it's in the past, why are there still such stark health disparities, economical insecurities, with Black Americans being 36% of low-income adults, the lack of employment opportunities, poverty, homelessness, untreated mental and cognitive issues, and the list goes on. James Baldwin said, "People are trapped in history, and history is trapped in them." We all have diverse backgrounds, education, and experiences, but I hope we have one thing most in common, that we all want to do better. We want to know how to elevate the needs and concerns of the health and well-being of people and enhance the quality of mental health care and counseling. Before this is possible, we must discuss how we can do better. We must first look at ourselves and how we view what we bring to address change. I know and hope everyone attending this conference believes that everyone deserves the right to live their life with conviction, respect, determination, and purpose. That every person has the right to be who they strive to be, regardless of race, ethnicity, gender, preference, religion, or disability. When we begin there, respecting someone's right to be who they are, we begin to understand that our job is to enhance their life, not just with medication or treatments, but with our humanity. Of course, this again is a gathering of professionals who understand how important mental health is and how the human mind works, the emotional, psychological, and social well-being required to function well in everyday life. Every patient you see comes with issues, some that can be addressed by the book of what you've learned through your education and experience, some more requiring much more of a challenge and need a different approach to care. But everyone you see comes with a history, a lifetime of experiences and relationships. I have heard this referred to as personal baggage, things we carry such as past experiences, long-held ideas, burdens, and impediments. I remember once hearing a minister say, "Black people do not have baggage, they have luggage." Well, we all nodded in agreement as if, we utterly understood the difference between the two. But when I went to the dictionary to see what the difference between baggage and luggage, and why those of us who heard this comparison just assume one was different from the other, well, as you know, English words can be used in different ways depending on context, and both baggage and luggage today generally mean the same thing: suitcases we take with us. However, in the Oxford Dictionary, luggage originally meant inconveniently heavy baggage, as rooted in the verb lug and the suffix age. Now, I cannot imagine that many of us who listened to this minister studied words out of the Oxford Dictionary, but we knew what he meant. There is baggage and there is luggage. And for most people of color, particularly Black people, there is a recognition of this context in the lives of Black Americans, a history that comes to be passed on through generations, that contribute to our perspective that not other groups of people in this country must bear. Inconveniently heavy baggage. It's only natural that most older people carry a certain amount of baggage due to normal life experiences with families and job and work and relationships. But for African American older adults who also carry the normal baggage of life experiences, they also have the additional heavy, excessive weight that includes the shadow of slavery and the perception of second class translated into additional stressors of society. One may not speak in a counseling session about the history of their people, but they live in a society that still perpetuates a historical unfairness. The current news reminds us of discrimination, exclusion, and suppression that have scarred so many aspects of civic life. State laws being passed that are designed to suppress voter rights. Congressional redistricting lines being drawn to dilute voter participation. Stand your ground laws. Inequitable sentencing in our judicial system. No-knock warrants with no consequences to errors. Stop and frisk. And book banning. And of late, we see how welcoming of this horrible crisis faced by the Ukrainian people, who we refer to as refugees, that are to be pitied and supported, while people escaping gangs and dictators and killings from the Southern Hemisphere are called illegal aliens to be scorned and caged. Can you imagine the message this sends to people of color? Is this a dog whistle? Do you see how it piles on luggage? I know that at least some of you do, because I have seen the scholarship and the research that has been published about how these experiences overburden the psyche. The term, I believe, is that allostatic load, the cumulative burden of stress, anxiety, fear, sorrow, shame, the luggage. And more in the mental health community are writing, speaking, and learning about it. History for people of African descent in this country has not been taught accurately or comprehensively in most school books. So it's understandable why these experiences are not commonly known. They are, however, told in family stories, handed down from generation to generation. My organization currently has older adults who knew their enslaved great-grandparents, whose grandparents and parents endured Jim Crow laws and segregation. These stories, I will call them, not only tell of the hardships of the time, but also act as teachings and warnings of how this country has and can treat you.
In Hopewell, the community was entirely Black. When my grandparents lived, both sets of grandparents, the community was entirely Black. And they were, my grandmother told me that you can't act the way you act when you're back home, because the white people here don't treat you the way the white people treat you in Washington. So, and I learned that growing up, and I respect that.
We've always been a people that said, okay, rather than deal with it, we'll just, why do you think that we've just been so resilient in that way?
Because we're the ones that suffer the consequence. That's my justification.
Absolutely.
I don't care how nice we were or whether we opened our mouth or not. They were the innocent ones and we were the bad ones.
Not much has changed.
No, not at all.
Injustice and inequity are not historical. We are reminded daily of the economic and the political differences that are reinforced, what people must go to and must endure. The burden of institutionalized unfairness are constant reminders of the disproportionate risk to physical, social, and psychological harm to Black and brown people. Older people of color carry these burdens, which are described by W.D. Du Bois as double consciousness, the concept of inward two-ness experienced by African Americans because of their racialized oppression and devaluation by a dominated society. Dr. Martin Luther King Jr. said, "We are not the makers of history, we are made by history." Now I know some of you are thinking, oh my goodness, I'm so tired of hearing about racism and discrimination. Slavery, Jim Crow, all of that is in the past. Now, if you're thinking that way, well, all I have to say to you is if you're tired of hearing about it, imagine how tired you would be living it. This history of action is how many Black people are still treated, how they are perceived. You may not be a racist, a term that has been so demonized by those who want to proclaim they are not. But we all have implicit and explicit biases. We all do. It's important that we look at ourselves to make sure we acknowledge this. When you hear the term bias, if you do not understand or you are offended, it may be you really haven't thought about the whole thing when you're evaluating someone. Implicit bias is an unconscious stereotype of someone different from yourself. Unlike explicit bias with conscious, deliberate prejudice, implicit bias, which we all have, operates entirely on an unconscious level because all of us come from different communities, various levels of education, racial and ethnic backgrounds, religions, cultures. We are all products of our environment. We inherit and we carry those biases we learned with us throughout our lives. So when we talk about cultural competency, we are speaking about implicit bias we learn that we may impose on other people, or in your case, the patient you care for, and not realize it. You may not in any way recognize that you have already decided that your patient, if different from you, is influenced by what you have heard or learned about that person's racial or ethnic group, and it may affect the way you communicate or treat that patient in your interaction. Being aware that you must actively be conscious of any bias you may unintentionally have must be set aside so that you're able to build an understanding between you and your patient, to acknowledge and to be open to the diverse cultural perspectives and accepting that that person's value and worth is important. Only then will older adults of color feel welcome and accepting of needed care. The true greatness of this country comes from our diversity, our diverse cultures, acknowledging our histories, the good and the bad. If we believe America is great, why would we need to make America great again? Why wouldn't the slogan be, "Let us make America greater"? We have to address the remaining issues of race that keep us from truly being the greatest. I hope in the field of mental health, we will see the change in how people are received and treated. And to counter, older African Americans must acknowledge their biases, what keeps them from seeking counseling, not allowing the challenges and the obstacles of stigma keep them from seeking care, overcoming their fear and distrust of not being treated fairly, sharing their true feelings, and not only being honest with their doctor, but with themselves. It is a mutual opportunity to change how we deliver mental health care. Aging and getting older brings its own challenges. Changes in your body and health, things you discover you can't do anymore, losing loved ones and facing the world without them.
My body reminds me that I'm aging. It makes me, I start focusing sometimes on the things that we take on as we get older. Some of the things that we start forgetting, at least walk with a walker, and just moving slower.
Sure.
And so it just reminds me that things have to change. It will change.
Ask you, because a minute ago you were getting emotional. Do you find that depressing?
Depressing now because my husband died almost 6 years now. And after 28 years of having somebody around, you feel like, growing old together. And still in the back of your mind, knowing that somebody's going to leave before the other, but still just having somebody with you. And so just the pandemic really made it very, very in my face. And I had to deal with, coming home and having to go through this by myself in my apartment. And, you just couldn't go with this and that, see people in the building you just didn't see. And it just kind of got to me.
Beyond how we care for older persons and their mental health, we need to be stronger advocates for changes in policy and funding support for mental health services. I cannot think of better advocates and partners than this body of geriatric psychiatrists. The way we improve the system is to join forces as aging professionals to ensure that no person, old or young, not have access to quality mental health counseling and therapy, which should be accessible, affordable, and culturally acceptable. Older adults need not continue to age in the dark. Our work together is not to just change history, but how we ensure that there is a future in aging in dignity, respect, understanding, and with the best care possible for all of those who seek and need good mental health care. Thank you.